Good evening, everyone. It's wonderful to see so many faces here today. Thank you for taking the time to join this important conversation about mental health. We're here to shed light on a topic that touches countless lives, often silently depression. Depression is more than just feeling blue. It's a serious mental health condition that affects millions worldwide. But here's the good news: with understanding and support, recovery is possible. Whether you're here because you've personally experienced depression, know someone who has, or simply want to learn more, you've come to the right place. Our journey tonight begins with understanding. What exactly is depression? What are its signs? And most importantly, how can we navigate its challenges and find hope on the other side? We'll delve into these questions and more throughout our time together. Depression casts a wide net, impacting not only our emotions but also our thoughts, behaviors, and physical well-being. It can drain our energy, steal our joy, and make even the simplest tasks feel insurmountable. But depression doesn't have to define us. Imagine a garden. Depression, like a persistent weed, can choke the life out of one's vibrant flowers. But with care, attention, and the right tools, we can cultivate a healthier landscape. We can nurture resilience, foster hope, and empower how is to thrive. One of the most powerful tools in our arsenal is self-care. Self-care isn't selfish. It's an essential practice for nurturing our mental, emotional, and physical well-being. It's about making conscious choices that nourish our minds, bodies, and spirits. Throughout this lecture, we'll explore the multifaceted nature of depression, delve into the power of self-care, and equip you with practical strategies to manage your mental health. Depression, also known as major depressive disorder, is often misunderstood. It's not simply a case of the blues or a passing phase of sadness. Depression is a serious mental health condition that runs much deeper, impacting our thoughts, feelings, behaviors, and overall well-being. Imagine a heavy cloak settling upon your shoulders, weighing you down both physically and emotionally. That's what living with depression can feel like. It's a pervasive sense of sadness, hopelessness, and despair that lingers for weeks, months, or even years. Unlike fleeting moments of sadness, which are a normal part of the human experience, depression persists, casting a long shadow over our lives. It can make it difficult to find joy in things we once loved, sap our energy, and make it challenging to engage in daily activities. It's important to remember that depression isn't a sign of weakness or a character flaw. It's a medical condition, just like any other, and it deserves understanding, compassion, and appropriate treatment. Depression manifests in a variety of ways, affecting people differently. Recognizing the signs is crucial, as early intervention plays a key role in recovery. Let's explore some common emotional, physical, and behavioral clues that may signal the presence of depression. Emotionally, depression often presents as persistent sadness, emptiness, or a lack of interest in activities that once brought pleasure. Feelings of hopelessness, worthlessness, guilt, and excessive worry are also common. Physically, depression can manifest as fatigue, changes in appetite or weight, sleep disturbances, either insomnia or oversleeping, headaches, and unexplained aches and pains. It's as if our bodies mirror the emotional turmoil we're experiencing. Behaviorally, depression can lead to withdrawal from social activities, neglect of responsibilities, difficulty concentrating, and increased irritability or anger. We may find it challenging to engage with the world around us, prefer in isolation and withdrawal. The spectrum of depression, variations in severity and experience. Depression isn't a one-size-fits-all experience. It exists on a spectrum, ranging from mild to severe. Some individuals may experience a single episode of depression in their lifetime, while others may face recurring episodes. The severity and duration of symptoms can vary greatly from person to person. Some individuals may experience mild symptoms that interfere minimally with their daily lives, while others may face debilitating symptoms that make it challenging to function. It's important to remember that even mild depression is significant and deserves attention. Early intervention and support can prevent symptoms from worsening and improve long-term outcomes. Factors such as genetics, life experiences, personality traits, and environmental stressors can all contribute to the development and severity of depression. Understanding the multifaceted nature of this condition is crucial in providing compassionate and effective care. Unraveling the complexity of depression's multifaceted origins. Imagine trying to solve a jigsaw puzzle without all the pieces. That's often how researchers approach the complex puzzle of depression. There's no single cause, but rather an intricate interplay of factors that contribute to its development. Think of it like a perfect storm, where biological vulnerabilities, psychological stressors, and environmental triggers converge. Just as no two storms are alike, the path to depression is unique for each individual. Understanding these contributing factors is crucial for both prevention and treatment. By identifying potential vulnerabilities, we can develop strategies to mitigate risks and foster resilience. And by recognizing the role of life experiences and environmental stressors, we can create a more supportive and understanding environment for those who are struggling. Let's delve deeper into the biological, psychological, and environmental factors that play a role in the development of depression. Biological factors, the brain-body connection. Deep within the intricate workings of our brains lies a complex system of chemicals called neurotransmitters. These chemical messengers, like tiny couriers, relay signals between nerve cells, influencing our mood, thoughts, and behaviors. In individuals with depression, the delicate balance of these neurotransmitters, particularly serotonin, norepinephrine, and dopamine, can be disrupted. Imagine a symphony orchestra where some instruments are out of tune. The resulting music may sound discordant and unpleasant, but the brain doesn't operate in isolation. Hormonal imbalances, particularly those affecting the thyroid and stress hormones like cortisol, can also contribute to depression. It's a reminder that our mental and physical health are intricately intertwined. Genetics also play a role, with research suggesting that individuals with a family history of depression may be more susceptible. However, having a genetic predisposition doesn't guarantee you'll develop depression. It simply means you may be more vulnerable to its effects. Section 3. Psychological and environmental triggers. Life's landscape and its impact. While biological factors set the stage, life experiences and environmental stressors can act as triggers, tipping the scales towards depression. Imagine a delicate houseplant. While its roots may be healthy, harsh weather conditions or neglect can cause it to wilt. Traumatic events such as childhood abuse, neglect, or the loss of a loved one can leave deep emotional scars that make us more vulnerable to depression. Chronic stress, such as financial difficulties, job insecurity, or relationship problems, can also take a toll on our mental health. Our upbringing and early life experiences also shape our resilience and coping mechanisms. Individuals who grew up in dysfunctional or unsupportive environments may be more susceptible to depression when faced with life's challenges. Even seemingly positive life changes, such as graduating from college, starting a new job, or getting married, can bring stress and trigger depression in some individuals. It's a reminder that any significant life transition, even a positive one, can disrupt our equilibrium and make us more vulnerable. Section 1. Empowering yourself. The importance of self-care in managing depression. Imagine a garden that's been neglected, overgrown with weeds and starved of sunlight. That's often how our mental health can feel when we're struggling with depression. Self-care is like tending to that garden, nurturing it back to life with care, attention, and the right tools. It's about making conscious choices that nourish our minds, bodies, and spirits, empowering us to navigate the challenges of depression and cultivate a brighter, more resilient sense of self. Self-care isn't a luxury, it's an essential practice for anyone seeking to manage depression and improve their overall well-being. When we're depressed, it's easy to fall into patterns of, negative self-talk, self-criticism, and neglect. We may withdraw from activities we once enjoyed, isolate ourselves from loved ones, and neglect our physical health. Self-care is about interrupting these negative cycles and replacing them with life-affirming practices that foster healing and growth. It's about recognizing that we are worthy of care, compassion, and attention even when it feels difficult to believe. By prioritizing our well-being, we're sending a powerful message to ourselves. I am valuable. I deserve to feel good. I am capable of healing. Section 2. Nurturing your body. Physical self-care strategies. Our bodies and minds are intricately connected. When we take care of our physical health, we are also nurturing our mental and emotional well-being. Think of it like tending to the soil in our garden, providing the nourishment our minds and spirits need to thrive. Regular physical activity is like sunshine for our brains. It releases endorphins, those feel-good chemicals that naturally boost our mood and reduce stress. Aim for at least 30 minutes of moderate intensity exercise most days of the week. But it doesn't have to be strenuous workouts at the gym. Find activities you genuinely enjoy, whether it's dancing, swimming, hiking, gardening, or simply taking a brisk walk in nature. The key is to move your body regularly and find joy in the process. Nourishing your body with a balanced diet is equally important. Just as a garden thrives on nutrient-rich soil, our brains and bodies function optimally when we provide them with the fuel they need. Focus on whole foods like fruits, vegetables, lean proteins, and whole grains. Limit processed foods, sugary drinks, and excessive caffeine, as these can exacerbate mood swings and energy crashes. Stay hydrated by drinking plenty of water throughout the day. Remember, food is not just calories. It's information that directly impacts our mental and physical health. Section 3. Calming your mind. Emotional and mental self-care practices. Just as we tend to our physical gardens, cultivating a sense of peace and tranquility in our minds is essential for managing depression. This involves nurturing our emotional well-being and finding healthy ways to cope with stress, anxiety, and negative thoughts. Mindfulness practices such as meditation and deep breathing exercises are like gentle breezes calming a stormy sea. They help us focus on the present moment, reducing rumination on the past or worries about the future. Even a few minutes of mindful breathing each day can make a difference. Find a quiet space, close your eyes, and focus on the sensation of your breath entering and leaving your body. Observe your thoughts without judgment, letting them pass like clouds in the sky. Engaging in activities that bring you joy and relaxation is another form of emotional self-care. Whether it's reading, listening to music, spending time in nature, pursuing a hobby, or simply taking a warm bath, make time for activities that nourish your soul. Limiting exposure to negative influences, such as social media or news cycles that trigger anxiety or comparison, is also crucial. Just as we protect our gardens from harsh weather, we need to shield our minds from negativity that can exacerbate depression. Section 4. Connecting with others. Social self-care for support and belonging. Humans are social creatures. We thrive on connection, belonging, and the support of others. When we are struggling with depression, it's easy to isolate ourselves, but this often exacerbates feelings of loneliness and despair. Social self-care is about nurturing our relationships and seeking out supportive connections that nourish our spirits. Think of it like ensuring our garden receives enough rainfall. Social interaction provides the emotional sustenance we need to thrive. Reach out to trusted friends, family members, or support groups. Sharing your experiences with others who understand can provide validation, reduce feelings of isolation, and offer a fresh perspective. Even small interactions like a phone call with a loved one, a coffee date with a friend, or attending a social gathering can make a difference. If you're struggling to connect with others, consider volunteering or joining a club or group activity that interests you. Remember, vulnerability is a strength, not a weakness. Allowing yourself to be seen and supported by others is an act of courage and self-compassion. Section 5. Cultivating a self-care routine, making it a sustainable practice. Self-care isn't a one-time event, it's an ongoing practice. A commitment to nurturing our well-being day after day. Just as a gardener tends to their garden regularly, we need to incorporate self-care into our daily routines. Start by identifying small, manageable steps you can take each day to prioritize your mental health. It could be as simple as practicing 5 minutes of mindfulness each morning, going for a 15-minute walk during your lunch break, or scheduling a weekly coffee date with a friend. Experiment with different self-care practices and find what resonates with you. Not everything will work for everyone, so be patient with yourself and don't be afraid to try new things. Remember, self-care is not selfish. It's an act of self-preservation. By taking care of ourselves, we're better equipped to show up for ourselves, our loved ones, and others, and the world, Ranfarm Bandu, and what of around us. As you cultivate a self-care routine, celebrate your progress, no matter how small. Acknowledge your efforts and be kind to yourself. Self-care is a journey, not a destination, and every step you take towards prioritizing your well-being is a step in the right direction. Imagine tending to your garden with unwavering dedication. Yet, despite your best efforts, the plants struggle to thrive. You've provided sunlight, water, and nourishment, but something seems amiss. Just as a gardener might seek guidance from an expert, there are times when seeking professional help for our mental health is essential. Self-care is a powerful tool, but it's not a substitute for professional treatment when depression lingers or intensifies. Recognizing the limits of self-care and knowing when to reach out for support is crucial for our well-being. If you've been diligently practicing self-care strategies, yet your symptoms persist, worsen, or interfere significantly with your daily life, it's a clear sign that professional intervention may be necessary. Depression can be a complex condition, and seeking expert guidance can provide the support and tools needed to navigate its challenges effectively. Don't hesitate to reach out if you experience thoughts of self-harm, hopelessness, or find it increasingly difficult to engage in daily activities such as work, school, or relationships. These are serious signs that require immediate attention. Remember, seeking help is a sign of strength, not weakness. Navigating professional help, therapy, medication, and support systems. Seeking professional help for depression can feel daunting, but it's a courageous step towards healing and reclaiming your well-being. Think of it like consulting a skilled navigator who can guide you through unfamiliar waters. There are various avenues of support available, each offering unique benefits tailored to individual needs. Therapy, often referred to as talk therapy or counseling, provides a safe and confidential space to explore your thoughts, feelings, and behaviors with a trained mental health professional. Cognitive behavioral therapy, a widely recognized approach, helps identify and modify negative thought patterns that contribute to depression. Medications such as antidepressants can be an effective treatment option for some individuals, particularly those with moderate to severe depression. These medications work by regulating brain chemistry, helping to alleviate symptoms and improve mood. It's important to consult with a medical doctor or psychiatrist to determine if medication is right for you. Support groups offer a unique form of connection and understanding. Joining a group of individuals who share similar experiences can provide validation, reduce feelings of isolation, and offer valuable coping strategies. Knowing you're not alone in your journey can be incredibly empowering. Navigating the mental health system can feel overwhelming at times, but remember, you don't have to do it alone. Reach out to your primary care physician, a mental health professional, or a trusted friend or family member for guidance and support. Recovery is possible, and seeking help is the first step towards a brighter, more hopeful future. The Titiyot, the weight of silence. Understanding the stigma surrounding depression. Imagine carrying an invisible weight, a burden you feel compelled to hide from the world. This is the reality for many living with depression, a condition often shrouded in stigma and misunderstanding. This stigma, like a heavy cloak, prevents individuals from seeking help, perpetuating a cycle of silence and suffering. Stigma manifests in subtle and overt ways, from dismissive comments like "just snap out of it," to the fear of judgment and discrimination in social and professional settings. It's the feeling of being flawed or inadequate, of carrying a secret shame that prevents us from reaching out for the support we deserve. The consequences of stigma are far-reaching. Individuals may delay seeking professional help, fearing judgment, or jeopardizing their careers or relationships. This delay can allow symptoms to worsen, leading to greater distress and impacting overall well-being. Stigma also creates barriers to open conversations about mental health, perpetuating a culture of silence that prevents individuals from feeling safe and supported. It's like trying to navigate a maze in the dark, feeling lost and alone without a guiding light. And cultivating compassion, shifting the narrative and fostering understanding. Breaking the stigma surrounding depression requires a collective effort, a shift in perspective that replaces judgment with empathy and understanding. Just as we wouldn't hesitate to support a loved one with a physical ailment, we must extend the same compassion and understanding to those facing mental health challenges. Imagine a world where mental health is treated with the same importance as physical health. where conversations about depression are met with empathy and support rather than judgment or shame. Creating this world begins with each of us. We can start by educating ourselves and others about depression, challenging misconceptions, and advocating for policies that promote mental well-being. Sharing our own stories, when we feel comfortable doing so, can help normalize conversations about mental health and inspire others to seek help. It's also crucial to treat individuals with depression with respect, kindness, and understanding. Avoid making assumptions about their experiences or offering unsolicited advice. Instead, listen with an open heart, offer words of encouragement, and let them know they're not alone in their journey. By fostering a culture of compassion, empathy, and support, we can create a world where individuals feel empowered to seek help without fear of judgment, knowing that their mental well-being matters. Together, let's break the silence and build a future where mental health is valued, understood, and supported. Embracing hope, cultivating resilience, our journey towards mental well-being. As we reach the end of our time together, let's take a moment to reflect on the journey we've shared tonight. We've explored the complexities of depression, delved into the power of self-care, and acknowledged the importance of seeking professional help when needed. Most importantly, we've begun to chip away at the stigma surrounding mental health, replacing judgment with compassion and understanding. Remember, depression doesn't have to define you. It's a chapter in your story, not the entire narrative. By embracing self-care, nurturing your mental well-being, and seeking support when you need it, you are taking powerful steps towards healing, growth, and a brighter future. Just as a garden requires ongoing care and attention to thrive, so too does our mental health. Continue to cultivate practices that nourish your mind, body, and spirit. Celebrate your progress no matter how small, and be kind to yourself along the way. And remember, you're not alone. Reach out to trusted friends, family members, or mental health professionals when you need support. Together, let's create a world where mental health is valued, understood, and supported. A world where everyone feels empowered to seek help without fear of judgment, knowing that their well-being truly matters.